Hi guys, can you all see me and hear me? I am so sorry for the delay. Actually, I'm having a problem connecting my iPad, so I've just come with the video. I think because it's an AMA session, I don't really need a presentation, so I think we can just go live like this. So just let me know if you can see me and hear me fine, then I will start the session. So this is intended as an AMA session wherein you can ask me any doubts that you're facing as far as your preparation is concerned. And not Zara's birthday, your preparation. All right, so I think, yeah, you can see me and hear me. So, all right, I think we're all set. So before we start, there's one announcement which I have to make as far as Unacademy is concerned. I don't have the poster, but we'll share the link in the description wherein starting tonight, 12 o'clock for the New Year's, you have a 23% off on all the subscriptions as far as medical PG is concerned. So if you're looking to subscribe to Plus, you can definitely use this offer. All right, so we'll make sure we pin the link to that in the description and in the comment section also. All right, so let me know what is it that you're facing trouble with as far as preparation is concerned. One of the common themes, I think, is your score, your GT score being stuck. I think that is a problem which a lot of you are facing, right? That you feel you're doing everything right, but still your GT scores improvement is not a reflection of that. Just type a yes if that is a problem that that is troubling you. Then I will begin to answer that, because that is something which I feel a lot of you are having a problem with. So I think that is one common query which I get a lot. The second common query is, you will give me all of your resources, that ma'am, I've done this plus this plus this. The various permutation combinations would tend to include Unacademy plus RR, it would include DVT, it would tend to include cerebellum, right? So you would have done a variety of resources and you want to know if it is enough or not. So that is also a second thing which I want to address, right? That you have a bunch of resources, but you don't know what to do, how to go about it. So let me first begin answering these two, and then I will talk about any personalized queries that you have. All right. Okay. So the first thing which I want to talk about is GT score. See, one thing that you need to understand is, do not take GT ka number score to heart, because that is not a true reflection of the exact score that you will get in the exam, obviously, right? Because the exam that you're attempting, the GT that you're attempting, is going to be very different from the actual paper. For one, what we have seen through the past, if you analyze previous NEET papers, it is usually easier than the GTs that you are attempting. So the problem is that the easier the paper gets, the higher is the clustering, right? So right now, just listen to what I'm saying. I'm telling you how how you want to approach the GT scores. All right, so I'm just telling you the mathematical basis of that. So what will happen is, your actual NEET will be easier compared to the GTs that you're writing. So what happens is, there's a lot of clustering. So the questions which actually make the difference, 100 questions, 110 questions, 120 questions even, everybody will be able to answer who's done a thorough, one round of good preparation from any resource, whatever. All right, so you would be able to answer 120 questions, right? Apart from that, the remaining 80 questions is what decides where you're going to be placed as far as the ranking is concerned. All right, and those 180 questions, if you look at it, that is how your GT is. So the actual score, if you're scoring 110 on GT, it doesn't matter. You're definitely going to score more in the NEET. But what matters is the percentile. What percentile are you at, and is it improving? Because it is actually those 80 questions which are translating into the 200 questions of the GT. I hope that makes sense to some of you at least. So the thing is, do not take the GT score seriously. The number ki 110 पे stuck है या 120 पे stuck है, वो important नहीं है. Important है percentile, and percentile should improve. And apart from that percentile number, what is more important is that you have to have that feeling. That feeling is very very important when you're writing a GT. कि वो feeling that are you able to recall what you've read? Are you able to revise well? Are you on track as far as facts are concerned, easy questions are concerned, previous year questions are concerned? These are the lessons that you have to derive out of a GT कि इसमें से mistake नहीं होना चाहिए, right? कि ये बहुत बहुत important है. कितना percentile होना चाहिए? Again, it's not important, just that you need to keep improving. You know, again, percentile is gonna be subjective, but you have to see an improvement in the percentile, not in the actual score, because that is gonna be very subjective depending on the mock that you're writing. All right, so try to look for an improvement there as far as a barometer for your improvement is concerned. Apart from that, feeling, as I said, is very important कि कहाँ पे खराब हो रहा है. अगर previous year questions are getting right, whatever you've read you are getting right, then there's a problem with the analysis, right? You're not reading the exam paper well. In that case, MCQ giving strategy needs to improve. I talked about it in the last class as well. The 2-month plan which I had, I did talk about it. How you have to approach MCQs, how you have to read between the lines, you know, those are the things that you have to improve upon, and that comes with practice. So if facts are in place, previous year questions are in place, then what you need to work on is give more and more MCQs, right? So at this point, one common thing for all of you, if I can suggest, right, what is it that you do now? Whatever is the timetable that you're following, timetable is not important. What are you doing with the subjects? It's very very important. So now, depending on जो आपके सारे resources है, the ocean of resources you are surrounded with, how do you navigate it? सबसे पहले pick one fundamental resource. All right, pick one fundamental rapid revision of your choice. All right, those of you who've done Unacademy plus RR with me, please choose that. All right, choose that as your fundamental resource. So let me just take you through the process. I was just talking to a student before this session started, and I was just telling her the exact same thing which I'm going to be telling you. All right, so what you have to do is, let's say you're starting off PSM. All right, whatever is the timetable, tomorrow I have to do PSM. I have to do PSM in 3 days. So the kind of time that you want to give is 3 days for the longer subjects like PSM, obs, gynae, medicine, surgery. Around 1.5 to 2 days for the medium category subjects like ophthal, anat, physio, biochem, micro, pharma. All right, and for the cute subjects, you know, those of you who heard me before, cute subjects matlab short subjects of final years, forensic, ये वाले cute subjects. Why are they cute subjects? Because they're very small, they're very high. उनको हम देंगे 1.5 days. All right, 1.5 days. So these are the 3 category of subjects. Let's say I have to finish PSM in 3 days. I'm starting off with PSM. What you have to do is, whatever is your fundamental resource, चाहे वो Unacademy plus मेरा वाला class हो, or it is Prep Ladder RR, or it is whatever RR that you are using, right? You want to first see that, just see that class. If it's PSM which I have taken, it's gonna be 5 hours of PSM RR which I have taken, right? So just play it on 1.25x, or you know, if you've seen it before, 1.5x pe dekho, such that you finish off entire PSM video in 4 hours. So in your mind you have one set fundamental which should not be that fundamental should be very strong, it should be unshakable, right? That उसमें से सवाल आया वो गलत नहीं होना चाहिए. So what you do is 1.25x पे 4 hours you've invested, you are not moving anywhere in between. पूरा का पूरा देखो, I'm not reading your comments right now, I'm just talking, so just listen to me right now, and then I'm gonna take up your doubts. All right. So what was I saying? Yeah, 4 hours you're not moving, you're seeing that RR from whatever resource you have done. After that, download the annotated PDF, give a quick look of the 3 PDF of the 3 classes which I have taken. All right, so जैसे ही आप PDF देखते after listening to the class, no, you have that visual memory. All right, you have that visual memory of everything that you have heard, and then it goes in your mind one more time, and that is how you form that strong memory, long-term memory, by reinforcing it then and there. So that is the most crucial step that a few of you might be missing, right? So जो भी आपने, no Hindi na, I'm not using any Hindi, just don't worry about it. Okay. All right, so that is something which is very very important. Okay, ठंड में पहले syllabus cover करो, अपने आप को cover बाद में करना. All right, so covering syllabus is what is gonna count in the exam, not covering yourself. Okay, right. After that, what is very very important is you have seen the PDFs. ठीक है, ये समझ में आ गया, PDFs देख लिए फटाफट, 30 minutes it will take entire 3 PDFs देखने में. All right, so that is done. After that, yeah, FMG also same thing. All right, same for FMG also. same strategy which I'm saying you have to follow. Right now I'm telling you how to read subjects. All right, so this is the most basic level of advice which I am giving, which is applicable to everybody. All right, तो आपने PDF देख लिया. इसके बाद now you are very you have done a lot of resources, right? You've done cerebellum also, you have this TND also, you have that TND, you have one more batch course. So after this, whatever else, suppose you have some TND notes with you, suppose you have some academy notes with you, right? What you're gonna do is you are gonna go through these notes very quickly, very actively, with a process to find out what is new. इसमें क्या है जो मैंने नहीं पढ़ा, right? So whenever you are going about and looking at something to find something new, are you again revising that thing one more time in your head? For you to find what is new, you need to know what is old, right? Are you getting my point? So when you're scrolling through that TND very quickly to see कि ये मुझे आता है, ये मुझे आता है, this is new, you are putting a box around what is new, you are again in your mind actively revising the RR notes one more time. So you are further strengthening your base. So this is what you have to do to bring all of your resources together. ठीक है? So this is the first step where we are reading everything. Got it? So this is how we have done the theory. But this is not gonna be enough. A lot of you keep asking कि मैम ये plus ये, is this enough? It is not enough unless you do previous year questions. So one thing to make it enough is now do PSM previous year questions. All right, do all of the PSM previous year questions of 3 years NEET, of 2 years FMG. 2 years FMG means 4 FMG papers. ठीक है? तो क्या क्या करा? 3 NEET plus 4 FMG papers, so 7 papers. If you still get time, you want to do 2 years of INICT. 2 years of INICT equals 4 papers. तो कितने papers हुए? 3 plus 4 plus 4. This is the maximum number of previous year questions you want to do. I hope this is clear. Yes, so one more query, कितने PYQs करने हैं? ठीक है? So this is sorted. So these are the previous year questions that you are doing to make sure you've covered all of these areas in your 1+1+1 resources, right? If you've not covered a single MCQ, read that solution and be done with it. बाकी कोई solution नहीं पढ़ना. Got it, everybody? So this is what you're gonna be doing. I hope this is clear as far as what is the approach to a single subject. Now, is this enough? No, this is also not enough. What you have to do is you have to keep bringing 19 subjects together. PSM to ho gaya, but after I'm done with 19 subjects, in the end, how do I still remember PSM? I'm going to forget completely about the first subject which I have done, isn't it? So what you got to do is now every single day allot 2 hours. From this point onwards, now is a very good time that you've covered at least one round somewhere or the other you must have read, right? So what you got to do is 2 hours every day, try to have an agenda, try to have a target of completing 100 MCQs on a daily basis in 90 minutes. ठीक है, 100 MCQs 90 minutes, very quick, very efficiently you need to solve. And now how do you solve these MCQs? किस subject के करना है, क्या करना है? So I want you to do something which is called as cumulative MCQ revision. This is just something which I have come up with, alright, just a random phrase which is cumulative MCQ revision. इसका मतलब क्या है? Like you have an ogive. Do you know what is an ogive? We've done it in PSM, है ना? PSM में पढ़ते हैं ogive frequency, cumulative frequency, polygon बोलते हैं उसको. So उसमें क्या होता है? Cumulatively you are constantly increasing such that you reach the 100th percentile towards the end, right? So इसमें भी same चीज करना है. What you're gonna be doing is you start off with PSM. आज PSM है, PSM के 90 MCQs, 100 MCQs करें. Tomorrow when I'm doing micro, or 3 days later when you're doing micro, what you're gonna be doing is PSM plus micro revision in that 90 minutes. Third subject, you are doing 1, 2, 3 subjects ka custom module. Fourth day, 4 subjects ka custom module. Such that 19 subjects ke end mein you are doing a custom module of 100 MCQs of 19 subjects mixed bag. Alright, I hope this is clear to all of you, that cumulatively you are bringing all of the subjects together. One more exercise that you have to do, is make a Choti copy. What is a Choti copy? Choti copy is like any book, all right? It can be this big also, like a peacock, all right? So this is my Choti copy. If you can see, it is pretty used, and you know, this is how you have to make a book wherein you are just writing stuff which is very volatile. So by this exercise, you would be able to complete one round by say mid-February, all right? Mid-Feb to 5th March, what you do is very, very crucial. So in that, you again have to bring 19 subjects together. How do you do that? So you do that by writing the volatile points of PSM. Say I'm revising PSM. So what I'm gonna do is I'm gonna write stuff like formula of odds ratio, attributable risk, PAR, screening के formula, biomedical waste management, NIS basically क्या freeze sensitive है, क्या heat sensitive है. So stuff which is volatile, which I know I will forget, I need to look at again. तो उसको फटाफट डालो. Again, do not make a thesis in this छोटी copy. It has to be very volatile, very high stuff. ये नहीं कि कुछ भी डाल रहे. Because this is the exercise that you're going to be doing on a daily basis. रोज का 1 घंटा you're reading this copy. Again, at the end of 19 subjects revision, 19 subjects का volatile stuff is there in this copy and वो आपको revise करना ही है. I hope this is making sense. Okay, so this is how you are going to lead your life till 4th of March. 5th के बाद जो करना है लाइफ में कर सकते हो. Till 4th of March, make sure daily basis 8 hours a day you are focused on subject of the day. एक fundamental बनाओ, उसके ऊपर then revise other resources, then do previous questions. Got it? That is subject wise. 8 hours a day. 2 hours a day you are spending doing MCQs. 90 minutes MCQs, half an hour reviewing those MCQs. Right? Very quickly, just see whatever is being missed. And after that, rest of the 1.5 hours that you have, read your choti copy. All right, और भी time बच जाता है, then you can revise one Midnight Express every day if you've seen it before. If you've not seen it before, just forget about it, forget that it exists. All right, or you can just see BTR which I have taken. All right, so that is what you have to do. Now tell me, what are the doubts? So I think this should settle the approach, and if you follow this, whatever you have done is enough. I hope the question of enough is answered. कि क्या इतना कर ले तो 150 आ जाएंगे, क्या इतना कर ले तो 160 आ जाएंगे. Again, understand that 160 will come from you on the exam day. It will not come from me who has taken the RR course writing the exam. All right, so that is not gonna come from the resource, है ना. DVT खुद चल के exam नहीं दे रहा, आपको exam देना है. So that is something that you have to understand, that nothing is enough. You have to have it in your head and you need to apply that knowledge in the exam. That is something which is going to be very crucial. All right, so that is something which we want to understand. What will be the future of TOTD? Future of TOTD is over. Topic of the day we've already covered, which were to be done, 45 topics. There are a few topics which I am yet to take classes on, like immunology, arrhythmias, which I will take in the due course of time before your NEET. All right, so that is what is very, very important. Okay. Right. From when should I stop studying new materials? From today, from this moment onwards, please study only the material you've done. All right, because there's no point in living in FOMO and doing everything and then end up remembering nothing. So you have to trust what you have done and just stick to whatever is the resource. All right, focus on rapid revision at this point, create a fundamental and then build up with new resources. So that is something which I would suggest to all of you. If other people are getting 151, don't focus on that, right? Other people से क्या फर्क पड़ेगा? You have to focus on your own journey, right? So you have to focus on your own process, and your own improvement is very important. GTs are, why are you giving GTs? Is that score your actual score? Are you getting a seat out of your GT? You are not, right? तो उसके score का क्या करना है, दूसरों के score का क्या करना है, doesn't matter. So what you have to do is you just have to see where are you lacking, what is it that you're struggling with. Is it time management, is it recall, is it reading between the lines? So you just got to work on that, as I said in the first part. So that is what is very, very important. Okay, if you've not done first aid, forget about it right now. If you still want to do first aid for biochemistry and microbiology, I would still recommend revising it, with your notes. It would be a very high yield resource to do those two subjects, at least if you have not done the rest of it. Systemic, you can just forget about it right now, not very important. But the first part of first aid, which is micro, biochem, immuno, general path, general pharma, I think that's still very high yield and still can be done. It's not too late to do it. ठीक है, पार्थ, तो पार्थ का भी सवाल आंसर हो गया. फर्स्ट एड के 1-2 और सवाल थे, वो भी आंसर हो गए. ओके, राइट. सी अगेन 90 राइट्स मतलब जितने भी राइट्स है फर्क ही नहीं पड़ा, इंप्रूवमेंट चाहिए ना अल्टीमेटली, चाहे कहाँ पे भी हो, भी ऊपर आना है ना. सो दिस इज हाउ यू जस्ट फॉलो व्हाट आई हैव सेड एंड यू वांट टू कम अप, राइट. जितना भी है उससे ऊपर आना है तो उसको करना है. नाउ टॉकिंग अबाउट लो डेज, सी everybody is gonna face anxiety, everybody is gonna face lack of motivation ki why am I doing this, what am I doing with my life, while people are enjoying, people are dancing, people are going on trips abroad, right? Why am I just here and studying, so why me wala phase always comes in life. No matter where you are at, you are at the peak of your career, still there will be days where you will feel why me, why is this happening to me only. So that is a very normal phenomenon to happen, very physiological. So all you got to do is maybe take a break for a few hours, right? Just forget about the monotony of what you're doing. It's a difficult phase of life, definitely. You are preparing for something where there are only 3 hours, which are going to determine what you're going to do for the rest of your life, isn't it? So there's a lot at stake, so it can be very nerve wracking at times. So you gotta just get a reality check, talk to your parents, talk to your friends, if they are willing to give you a reality check that your exam is not the center of your life. अगर वो लोग ही खुद ही ये सब चीजें बोल रहे हैं तो don't talk to them, right? Then you just see some Netflix series, right? Just talk to somebody who has a different point of view, a different approach in life, who tells you that this is not the end of life. This is just one phase of life. This is just the last 2 months of your life where you gotta give it your all and just finish this exam off, right? That is all it is. Ultimately, that's an exam that you need to finish off, right? So just take it as an exam. Do not make it center of your life. Take a break for a few hours, watch a movie, go out and, take a walk in fresh air, see what life is all about, and come back and then start off with something that you like. Again, don't pick up anatomy or PSM, and so again you'll go into that vicious cycle. So just pick up maybe derma or radio or something nice, and then again go back to whatever it is that you were struggling with. Okay, so that is how you have to approach this 2 months, because it's very important you don't burn out. रोज के 12-12 घंटे पढ़ना is not easy. It will lead to burnout, right? So you need to take care of your mental health. That is something which is very, very important. Okay, right. What else? If there is 20th notebook of someone from your more, see 20th notebook is best made by yourself, right? लोगों ने बना के दी है आपको 20th book, and I am one of those people जिन्होंने बना के दी है. But the best is you use those books also, but the best is what you make for yourself, because you only know what you will remember and what you will forget from whatever resource you've done. And to revise it on a daily basis, you want something. रोज अगर आप किसी चीज को 1 घंटा दे रहे हो, you want it to be high, right? So try to, whatever you are reading, आज जो पढ़ रहे हो उसको लिखो ना. तो 20th notebook doesn't have to be like something magical that you are looking for. You just want to basically create a high resource and revise it on a daily basis, such that towards the end you have everything coming together. I keep using this phrase that exam hall mein jaane se pehle everything should be there. You should have that confidence that I have touched all 19 subjects. That is very important. How often to take a grand test from now on? I think once in 15 days is good enough for January. So January maybe you can take 2 or 3 maximum GTs. February just target one GT should be good, and that's it. So 4 GTs from now on I think is a good number to give. All right, four GTs from now. All right, I think pay scale of general medicine is not a doubt that we want to address now. Right now, you want to get to a point where you can get the opportunity to take whatever you want and not worry about the pay scale, right? So we don't want to worry about that at this point. We want to reach a point to get general medicine first. How to read fast? Again, read fast is something that will come with time, right? Read fast is something that is that's a skill that comes over years. So you have read something first, only then the second read would be faster. So there is no trick कि ऐसे read fast कर सकते हैं. So you need to see the same material, you need to see again, and only then you will be fast. And again, make sure you're not zoning out. A lot of times you're reading the same notes again and again, और उसको बस हम पढ़ते रहते, but we lose the essence. So very important, you are active and you're looking for high points, you're looking for previous year questions, previous year topics. So you have to be very active. A lot of times अगर बहुत बार notes पढ़े हुए हैं, you zone out while you're reading. So very important that you are not zoning out. You're doing an active reading, not a passive reading. Again, very, very important. Okay. Yeah. I hope that is clear. Reading to MCQ ratio is what does that mean? So I think I did tell you the number of hours. So 8 hours should be your previous year question plus your study material. 2 hours a day daily dedicate from this point onwards, today onwards. 2 hours mixed bag cumulative MCQ revision every day. All right, so I think that answers your question. Right, what else? Which, and again, I am reading it out, just stop copy pasting one thing again and again. All right. So here, what you're seeing is my Choti copy. All right. So if you want to, if you're very interested in Choti copy of mine, this is what it is, but doesn't matter, you know. Please take free class on bacteria. You can see the MKI on micro, which I've taken. All right. A lot of it gets covered here. Baki, I've covered it on plus. All right. So for free class, you can just see the MKI, which I've taken. It covers the entire micro almost in 1 hour, I feel. Okay. How to revise surgery, medicine, OBG in last. Yes. So again, Vikas, it's very important that you do rapid revision. है ना? Rapid revision video पे focus करो and focus on previous year questions. So you have to be very selective in all of these 3 or 4 subjects. You know, your large subjects, you have to be very selective. Do previous year questions, do rapid revision. That's it. है ना? पूरे notes पढ़ने जाओगे तो खत्म ही नहीं होगा कभी. So you have to be very selective and smart about these subjects. Okay. I will take ECG in the coming days. Just don't worry about it. All right. So I will take ECG. I will take immunology. Just the like the highest yield. I mean, I'm not gonna take a PG course on ECG. I'm just gonna take an ECG for dummies class. Right. जिसको बिल्कुल ECG नहीं आता, they can just attend and like just maybe secure that 1 or 2 questions that you get from it. Anatomy also I've taken part on plus. You can just see the classes which I've taken. You know, I mean, I don't know how else to help. TOTD, we have already finished the topics which needed to be done. The newer ones, I think 45 थे, उसमें से there are 5-6 which I have to take now. So I will definitely take them in the coming days. All right, immuno I will take in the coming days. Should we take the whole BTR into 20th notebook? Again, you will know, right? When you see, try to remember it in the first read, and then you will know, right, that all right, this is the stuff which is volatile, and BTR anyways is stuff which is meant for things which is volatile, right? BTR is buri tarah rato, so these are classes which are focused on volatile stuff. So you can just see these PDF. No point of translating it again into your Choti copy. Just see the PDFs and finish those topics off. That is a Choti copy which I have made for you already, right? तो उसको तो आप फटाफट से उसी को रिवाइज कर लो, right? Why again copy paste it and write, है ना? So don't do unnecessary exercises. Unacademy TND cover FMG PYQs also. Which Unacademy TND? So there are 2 batches. There's an all educator batch which is going on. So I'm sure that covers FMG PYQs. Apart from that, the one which I am going to take in January, I will try to cover, yes, the entire set of previous year questions which I mentioned. I will try to cover that in the TND. Okay. Post PG radiology course, I have absolutely no time right now, but yeah, in the coming year, next year, maybe I will try to find the time to do it, but not before April for sure. All right, what else? Any tips for remaining days in FMG? See, again, all you got to do now, so you have 20 days which are left, right? So 20 days mein you just have to revise the highest yield points, right? So what you can do now is whatever are the rapid revision notes that you have, usko fatafat se dekho, see the BTR classes which I have taken. So volatile topics are sorted and previous year questions. Ultimately, you cannot get previous year questions wrong. So you have to do previous year questions. Uske baad do the rapid revision and see BTR, you know. So these are the 3 resources I think that you should stick to at this point as far as the FMGs are concerned. Okay. So again, you don't have to copy paste entire thing in Choti copy. Again, I mean, you just have to write the most volatile points, right, which you want to give one more look at. So again, it can't be a duplication of your entire surgery. Pura surgery nahi copy paste karna. Only the most volatile stuff. Like I said, example of TSM, just you can do that. So surgery, basically just write down maybe sutures ka classification likho, write down the scorings which are very important. MELD में क्या आता है, चाइल्ड पग में क्या आता है, यू नो. सो स्टफ विच इज वेरी वॉलेटाइल जो आपको एक और बार देखना है. यू कांट राइट डाउन एंटायर सर्जरी इन द छोटी कॉपी. 1 GT for FMG, I think 1 is good enough. Okay. If you want to start now more in TOTD, just see the last 2 month wala class which I have taken on the app. You will find the link on the Telegram group. Usme I've given you a list of the classes that you should see now if you are starting, at this point. There are some 5 classes per week. I have made a timetable for you, and I have just handpicked the classes which I feel are gonna be high for somebody who's not done my classes. So these are the free classes which I have handpicked, and you can just see that. All right, so you can just go through that. All right. What else? Thank you so much. So I guess that is how to distinguish abscess and empyema in chest X-ray. See, abscess is a pulmonary lesion, whereas empyema is a pleural lesion. So abscess is going to be a pulmonary lesion, as in it is going to appear rounded. On the other hand, empyema on the X-ray is a chest wall or a pleural base lesion. So it's going to have this broad base against the chest wall, right? So when you look at the hemithorax, अगर आपको उसमें एक round lesion दिख रहा है, that's an abscess. But along the chest wall, if you see an oblong lesion, right, that is how an empyema will appear, which is a loculated effusion. All right, so that is what it is. If the question is what is more MKT, you can just forget about it right now. I mean, if you don't know what it is, do not have any FOMO of it, right? Do whatever you have covered so far. Okay. I think all right. Now the questions are bordering on stuff which I don't think I need to answer. I hope this helps you in some way or the other. And please utilize this time to the best, because anything can happen now. For those of you who feel, can I get a rank now? The answer is a definite yes, if you use the time well, if you do the right things in the right way. Definitely it is possible. I mean, there is 100% no doubt ki you can crack it at this point also. Even if you're starting today, you can do it if you follow the right approach and be smart about it. Very important. All right, so that's very, very important. No, there's no subscription for my videos alone, but I think there's some offer which is starting from tonight 12, which will give you a special price. So we'll pin the link again in the description, so you can just check it out. All right, ECG free video is coming up very soon, next year. Next year, as in January, in the next 4 days it will come up. All right. Is INICT recall useful for FMG? No, just do FMG 2 years and NEET 2 years. I think that should be good enough. All right, NEET 2 years definitely karo, because you do get a lot of repeats from there. So FMG 2 years, NEET 2 years, I think should be good enough. Okay. All right. So I think all right. So I think that is all that I had for you. I hope this is useful to you. All the very best, and study well, and thank you so much.